Kia ora e hoa.
Kia ora, Emma.
Nice to see you. So really grateful to have you with us today. I know that you're a busy counsellor, and I'm a doctor working at Middlemore Hospital at the moment, so coordinating our diaries was a bit of an effort, but really glad that you could be here with me to have this kōrero about measles. Obviously it's something that affects our communities in particular. So just wanted to pick your brains a little bit about how much you know about this serious infection.
I don't think you'll get very far picking my brains, Emma, but we'll see how we go.
All good. So not that many people know this, but there's a large group of New Zealanders who've actually missed out on getting immunised against measles. Do you have any idea what years they were born?
No, not my guess would be in the 1990s, because I know that I got my immunisation. That was back in the early 80s.
Oh, that dates you a little bit. So a lot of New Zealanders who are aged 15 to 30 years aren't actually immunised against measles, which means that some people aren't fully protected. So if the disease was brought into New Zealand, they could be at serious risk. About 1 in 10 might need to go to hospital, and it can be more harmful to those with weakened immune systems, to our hapu mama, our younger whānau. You know, you could get really sick, and then also pass measles on to the people that you care about.
Yeah, and I probably thinking back to what happened in Samoa and what's been going on in South Auckland as well last year. So, and that was pretty, it was pretty challenging for our community.
Yeah. So, I think for people that aren't sure if they've been immunised or not, the best and safest thing to do is to go to their local GP, get some more information and get immunised again. It takes 2 doses of the vaccine to be fully protected. So if you're not sure, it's okay to get immunised again.
And you can just go back to your local GP, go back to your clinic and ask them how things are. They'll have a record somewhere?
They should do. There are also some pharmacies who are qualified to provide the vaccine. But yeah, I think first port of call, really safe to go and see your GP and just say, look, I'm interested in checking to see that I'm immunised against measles. And some people wonder, this is the most common thing that we hear as doctors, you know, can you still get vaccinated if you have cold or flu? If it's old, it's still really safe for you to do that. But if you have a severe illness, then it might pay to wait until you get better and maybe again have a chat with your GP about figuring out what's best.
Yeah, well, that sounds easy enough. And I think it's cool that you're doing this because it's important that our community feel like they can be safe. A lot of our people don't like to go to the doctor because we're all scared. So I think this will be good even as a family thing to do.
Yeah, that's a great idea to take everyone along.
Thanks, Doc. I'm really interested to see if the vaccine for measles is still free.
Yeah, absolutely. And that's a really important point. Good for whānau to know that it's completely free, and the access should be easy. You should just be able to go to your doctor and say, I want to have my immunisations, and they'll be able to give it to you. You've done your research on this one.
I try and be a good boy and know things, but I think it's really important for our community because we want everyone to feel safe, to feel like they've got good health and well-being and good access to their GPs and their clinics. So this is really important.
Absolutely. So just to reiterate, there are some people in New Zealand who won't be fully vaccinated against measles, and those people are particularly within the 15 to 30 age range. You need 2 shots of the vaccine to be fully immunised. You can get it from your GP, from some participating pharmacies, and there are some healthcare professionals that can offer immunisations at some community events and some schools, so keep an eye out for that. It's completely free and one of the best things that you can do to protect your whānau and community. So be a guardian of the future and find out how at protectagainstmeasles.org.nz.